Hi class, it's Professor Brown. I've had most of you, I think, in at least one of the few classes over the last few semesters. I just really wanted to touch base about the reading and some of the key concepts that hopefully you're taking away from it this past week or week or two. You should have been reading, at least you should have gotten through chapter 1, and then you should have 2 and 3 out of this text that needs to be read, for this week as well. Many of you probably know that this course is combined. It has CNLs, clinical nurse leader students, and DNP, Doctorate of Nursing Practice students in it who are going to be nurse practitioners. I'm sure many of you know that a DNP can also have, in other programs, not be nurse practitioner focused, but in our particular program, our DNPs are nurse practitioner focused. So our clinical nurse leaders are getting their master's degree, and they will be mostly working in microsystems settings where they'll be working in hospitals or community-based clinics. Some may go into education or other areas, but they're really taking a look at evidence-based practice outcomes and looking at how to improve value and outcomes in a setting. So this week's reading was very interesting. I know it was more DNP focused, but I think it's important because our CNLs, some of them will be going into roles where they're going to be managers of units, and they're going to be looking at costs and value and outcome. And I think it's really important, even for the CNLs, that you have a really clear understanding of even the DNP role and then how reimbursement works. So I know the text talks a little bit about looking at outcome and outcome assessment. I think I just really want to back up and share a little bit about the history of why that's become such a big deal recently over the last few years. With the Affordable Care Act and the passing of it, previously, physicians and nurse practitioners had always been reimbursed based upon fee-for-service, meaning every time you go into the doctor, there's a fee that's applied to that visit. Or whatever procedure's done, there's a set fee for it. That's then negotiated with the insurance company as to what the reimbursement's going to be based upon your insurance and the agreements that are made. Well, what happened underneath the Affordable Care Act, and many of you may know this, but some of you may not, so this is new information, is that reimbursement really started to change. They really want to take a look at, instead of just reimbursing for every office visit or every procedure that's done, we want to look at outcomes. And throughout the world, most healthcare systems look at outcomes. England or United Kingdom, they have a primary care provider managing a group of patients, and they look at the outcomes of that group of patients. Based upon that is how that provider gets reimbursed. So we're seeing a big move to that. And your text talks a little bit about the legislation that came out about that on page 2. It's called MACRA, Medicare Access and CHIPS, and the Reauthorization Act of 2015. And what that did is it said, we're going to move from fee-for-service and we're going to look at outcome and value. What's interesting about this piece of legislation is that it was very bipartisan. So it wasn't just the Democrats pushing it forward. It was also agreed upon by quite a few of the Republican Party as well. And again, looking at practice-specific quality measures in order to get the best reimbursement. Now, this was supposed to roll out fully, I think in 2016, but there was a lot of lobbying against it just because it was a complex piece of legislation to look at how things are going to get reimbursed. So it's been slowly rolling out, and you're seeing it implemented in different settings, either in the hospital or in private practice, as to how outcome metrics are going to be used. How this affects nurse practitioners is we don't necessarily have specific outcome indicators always for advanced practice nurses. And so that's what Chapter 1 really focuses on, is looking at outcome specific metrics for them. I think we have a great researcher here at MSU called Dr. Peter Bierhaus, and he is trying to advocate a lot for the nurse practitioner practice. And it's very hard for him to pull out a lot of the specific data as to the value, meaning how much money nurse practitioners save, and then their outcomes from their patients, because so much of that billing has been incorporated with the physician billing. So it's very hard to pull out, what's nurse practitioner specific and what's physician specific when it comes to the billing. Your book also talks about that on page 9, where it talks about inpatient settings, and I think it's 1, 2, 3, 4, 5, 6, 7, the 7th paragraph down. It says, it is more difficult to assess outcomes in the inpatient setting, given that most of the care is carried out in teams, leading to shared billing, which is many times attributed to a physician partner rather than a advanced practice nurse or physician assistant. So, one thing is, as you guys move into your different roles, even if it's management or whatever, taking a look at how we can identify different billing when it comes to nurse practitioners versus physicians, and being able to really take that data and say, yes, it's very beneficial to have a nurse practitioner in this role because it saves money and we have great outcomes. We would love to be able to have more research on that information as to the quality of care that nurse practitioners are providing. We know it's there. We know it's wonderful, but in the future, we just need to find ways to collect the data so we can start getting it out there that nurse practitioners are providing excellent care, very significant and very comparable to primary care providers as well. Just one other part too, and I'm sure many of you know this, but just for those of you that don't know, reimbursement comes from Medicare, and with the MACRA, reimbursement also changes based upon outcomes. And so in states like Montana, where our nurse practitioners have independent practice, we don't have to have always collaborative agreements with physicians. So nurse practitioners can actually practice in independent clinics. Under some of the new MACRA rules, we have different types of healthcare delivery systems that have been coming out throughout the state that can actually be independent run clinics that get higher reimbursement. And so, as nurses move into that, instead of maybe getting their 85% of reimbursement on Medicare, they can actually then get higher reimbursement. Because right now, nurse practitioners get 85% of what a physician would get. Again, if we can show the outcomes are just as good with nurse practitioners, then we can advocate for a higher reimbursement for our nurse practitioners that are out there providing excellent care. And so that's why, again, collecting that data is important. But in the future, with some of these outcome models, nurse practitioners will get some of that higher reimbursement that physicians would get if they're taking care of a group of patients. So there's a lot of really exciting things coming down the road when it comes to MACRA. That is, if it stays in place. We are now just starting to pull data, the government is, on the effectiveness of outcome and value based care rather than fee-for-service. That's going to continue to take time to take all that data in and be able to process it. But I think if we were to lose MACRA and go back to fee-for-service, which we know increases costs immensely to our patients and to our healthcare system, it's going to be sad because we don't really, we may be missing out on something that's going to actually, over the long run, decrease the cost that patients are having to pay and the government's having to pay if we go to outcome, and making sure our patients are getting healthier rather than just continuing to be seen. And if we can have that holistic care that nurse practitioners can provide and nurses provide, we may have better outcomes. So this chapter is very interesting, and I know outcomes probably isn't always the most exciting topic, but in the greater scheme of things, it's a very exciting, innovative new approach that our government has taken, and hopefully looking at the quality of care that we are giving. And I believe in my bottom of my heart that nurse practitioners and nurses give excellent care, and if we can just start to take the data and start improving those patient outcomes in the future, we can really advocate for, more independent practice throughout the country and also higher reimbursement rates for require nurse practitioners. So thank you, and hopefully that helps with kind of clarifying some of this week's readings. Thank you.